Measuring heart stress in a blood test can predict heart disease. That's the headline. But what does the science tell us? It's about this study published in Annals of Internal Medicine. It showed measuring a marker of heart stress called NT-proBNP predicted people more likely to die and more likely to develop cardiovascular disease. But this study was in a really specific group of people done in a particular way. Their average age was 78, and they measured levels at the beginning and again over several years. They found those people whose levels had gone up by year 3 or stayed high, they were more likely to develop cardiovascular disease. But, and it's a really big but, they were also more likely to be older, more likely to be overweight, more likely to be taking high blood pressure medication, and more likely to have kidney disease. So what does this heart stress blood test really add to looking at other markers which we know we can measure routinely, easily, and do predict risks? Things like kidney function and high blood pressure. I suspect probably not very much, because that's what we've often found when looking at BNP measurement as a screening tool. It doesn't add very much to measuring all those other routine tests. The most important of which probably is blood pressure, because that's the one I find so many people miss. So I would say this marker is not ready for prime time, and it's not one you just want to be randomly checking in a wellness panel, because it really helps those patients where we're worried about heart failure. You have to interpret the blood test as well with the whole clinical picture, because things like high blood pressure and anemia can elevate results. If you've enjoyed this doctor's note on the science behind the headlines, then please give us a like or a follow for more.